Hi, if you are suffering from hypertension or diabetes, or you have a parent or a relative or a friend who is also suffering from the same condition, this video is for you. My name is Catherine Kimani, and welcome to CK Smarter Creations. If you haven't subscribed, kindly hit the subscription button. So if you're suffering from any of these conditions, diabetes or hypertension, you need to do a couple of tests just to make sure that all is well and to make sure that you're not going to damage your organs and especially the kidneys. Test number one is a renal function test or a kidney function test. This will detect early kidney failure and the doctor will be able to help you as a patient. The number two test is a lipid profile that checks on the low density cholesterol, which is the bad cholesterol, and triglycerides. When these two are high, they will always make your sugar levels to be very high. The other test that needs to be done is an ECG. ECG checks on the heart rhythm. Remember, when you are hypertensive and your blood pressure keeps on going high and low, it can affect your heart rhythm. And therefore, it's very important to do an ECG. The other test that you need to do is a liver function test, because whenever you are hypertensive, your liver can be damaged because of the fluctuation of your blood pressure. The other test is called microalbumin that checks whether albumin is leaking in your urine. Very important. And the other test is HbA1c, or if you want, you can call it glycosylated hemoglobin. The HbA1c will guide the doctor who is helping you to know whether to put you on insulin or just on tablets when you are diabetic. Remember, when your HbA1c levels are 10 and above, the doctor most of the times will put you on insulin. But if your HbA1c levels are 8 and below, most of the times the doctor will not put you on insulin. Remember that HbA1c is better done after 3 months because it shows your blood sugars for the last 3 months in average. The other test that you need to do is also a urine test. When you are hypertensive, sometimes you will get some traces of blood in your urine. That shows that your kidneys have started to get some damage and some protein in urine. And when you're diabetic, you will also see glucose in urine, sometimes ketones, and this leads to a condition called ketoacidosis. The other test that you need to do when you are diabetic is doing a fasting or a random blood glucose test. This shows the levels of your glucose levels. If it is random, it is when you have eaten, and if it is a fasting blood sugar level, it is when you have fasted for at least 8 to 12 hours. So if you are diabetic, kindly make sure that you go to a good lab and do these tests, and this will save your life and it will save you a lot of things. Thank you for watching and see you in my next video. Bye bye.